Hi everyone, I'm Dr. Akhila, consultant fertility specialist, Siddha Hospital, Banjara Hills, Hyderabad. Today we are going to discuss about how to deal with IVF failure. So it is very important that we understand what is IVF and what are the different steps at which it can fail before we understand how to deal with it. So IVF failure is something which is very painful and it is emotionally draining. All the fears, all the hopes, the money spent, the physical processes involved all become futile once we get a pregnancy test that is negative. So let us first understand what are the reasons for this IVF failure. Importantly, it is the embryo quality. The oocyte quality and the sperm quality put together form the embryo, and the quality of which is very important for it to give you a pregnancy test which is positive. Also, the endometrial receptivity, that is the uterus, how it is responding to the embryo, the implantation window, the time at which we are transferring the embryo, lifestyle changes, PCO, endometriosis, fibroids. These are some of the things that can lead to a fertility failure. The different steps at which it can fail is that when we give injections to get the eggs to grow, some of them they don't respond to these injections. So that is one place where it can fail. Some of them they don't produce enough number of eggs, or we don't get enough number of mature eggs. This is another stage. Once the eggs are retrieved and we have enough number of eggs, then we mix them with the sperm, and these oocytes that don't fertilize is another stage at which we understand that IVF has not worked out. So this we call as a fertilization failure. These oocytes that have fertilized, they don't proceed to become an embryo either on day 3 or day 5. So this is another stage where we know that the IVF has failed if we do not get a day 5 embryo. Once we do get a day 5 embryo, if they are of poor quality, generally we don't transfer, we suggest for another IVF cycle. If the embryos are good quality, we transfer these embryos at an appropriate time, and once we check the uterine lining, that is the endometrium, which is of more than 8 mm, and still the pregnancy test is negative, that's another endpoint where we know that the pregnancy test is negative, and that's another stage of IVF failure. So these are the different stages at which an IVF can fail. And what is very important that we must understand is globally the success of any one single IVF cycle is about 40%. Here, our success rates are 60%, but nothing beyond that. So we must understand that there is a good chunk of population who can become negative in one attempt of IVF cycles. Uh, how to deal with this kind of a negative result? Communication is the key point here. You have to communicate with your partner first, understand what has happened and how we can change this in the next cycle. Are they ready to go for another cycle? So discuss with your partner, very important, and then discuss with your doctor. Typically, what happens is when a couple is going for another IVF cycle, we tend to change the protocol, we tend to change the injections, the way things are done. These are some of the changes that we incorporate just in the hope of a better result. And very importantly, don't blame yourself or don't blame your doctor. Once you have chosen a certain hospital, a certain doctor, and you have ascertained your embryology team, you should have faith in them and continue the process. The other way to deal with this IVF failure is having complete information about what can go wrong, at what steps that can go wrong, what is ideally the IVF success rate. These are some of the things that you must already understand to be able to accept the result. And lifestyle changes definitely play a very important role. Regular exercise, healthy diet in the form of vegetables, fruits, nuts, seeds. Add plenty of colored fruits to your diet. All these play a very important role. Antioxidants, supplementations with folic acid, vitamin C, E, and D in those who are deficient also plays an important role. Uh, Decrease in stress definitely has an effect, a positive effect. Doing yoga, meditation can help reduce stress levels. Uh, Communication, as I have already mentioned, these are some of the ways in which we can understand why IVF has failed and how do we cope with this kind of an IVF failure. So this is all about how to cope with IVF failure. Any questions, please? The first question, I'm having panic attacks and anxiety by just thinking about IVF and I can't focus on anything or control it. What can I do? So, like I've already said, it is all about trying to have complete information about what is IVF, how it is done. IVF per se is not painful at all. It is just a tedious process, as in you need to come to the hospital every day for injections for a period of maybe 10 days and a scan maybe every alternate day. This is about IVF. So you need to understand what is IVF, what are the success rates of IVF. Once you have complete understanding, automatically your fears come down and you set an appropriate hope for yourself. Next question, please. How can I approach a second IVF cycle as my first didn't work out well? What should I expect? So, like I've already said, in the second cycle, we normally tend to change the injections, we tend to change the protocol. We look at when the trigger is given, what kind of a trigger injection we give, and when do we time your procedure. The sperm selection also changes. We go for advanced techniques of sperm selection, and we add in newer techniques for those who it is required, like pre-genetic testing of the embryos, endometrial receptive array. Sometimes we also use techniques like laser hatching for the embryo before implantation. These are some of the things that we do once one IVF cycle fails. Is it possible to get pregnant naturally after a failed IVF cycle? Oh, yes, definitely. So it depends on what is the reason of infertility. So if the uterus is good, the endometrial lining is good, the tubes are patent and healthy, the eggs are present, intercourse is not a problem, sperms are adequate in numbers and motility. So natural pregnancy is definitely possible after IVF or before IVF. Anytime these criteria are there, natural pregnancy is possible. Please suggest how to remain calm during my IVF. Like I have told, it is all about having complete information. You have to educate yourself as to what can happen in your IVF cycle so you know what to anticipate. Once you have complete information, it is very easy to accept. And staying positive, yoga, meditation, these are some of the things that definitely help you in your IVF cycles and to deal with the stress that comes with the IVF cycles, more so if it is negative. Are there any other options other than IVF to get pregnant? Natural options, IUI, IVF, these are the different modalities that are currently in practice for pregnancy. Currently, I'm coping with two IVF failures. I can't even stand the fact that this has happened. I'm completely broke and trying to distract myself several times, but at least tell me what to do. So, like I said, it can be emotionally quite draining, but destigmatizing IVF is a very unique process. And it is unique because every couple's story is unique. So we first need to understand what has gone wrong in your two cycles to be able to cater a better plan for you. So this is something that we need to plan strategically, and each of these, the next IVF cycle should be individualistic. Like I have already mentioned, you need to have a change in the injections, protocols, trigger injections. Every step needs to be analyzed and changed as per what best we can give you. And from your end, lifestyle changes, that is quitting smoking, stopping alcohol, exercise, diet, at least about 2 to 3 months before you start the next cycle really helps. And importantly, if there are any infections, pelvic infections, these also can lead to a negative IVF cycle. So it is of paramount importance that we check for infections and treat them adequately. Thank you.